And then just on the just general ballpark of things like epigenetics and mutations, how might lasofoxifene's activity at mutant estrogen receptors, such as those found in therapy-resistant breast cancer, inform the use of bone microenvironments affected by malignancy? And I know we're in preclinical, but do you have any kind of
Yeah,
thoughts on that?
absolutely. So, mutations to the estrogen receptor are pretty common in advanced and metastatic disease. And so, um, a lot of times when we talk about bone metastasis, it's very likely that these patients will at some point acquire mutations to ER. And a lot of those mutations make it constitutively active. And so ER is a protein that has a three-dimensional structure. It has kind of an inactive and active conformation. And so when this protein acquires these mutations, it can kind of get almost locked in an active conformation, which makes it not really susceptible to a number of compounds because they bind the ligand binding pocket. And if that pocket is closed, they can't, I guess, get in to bind the estrogen receptor. And so, in addition to being constitutively active, it often makes these cells resistant to treatment. But lasofoxifene has shown to still have a high affinity for mutant ER, which is great for patients with advanced and metastatic disease who may have a mutation. So it's still going to be an effective treatment regardless if ER is wild type or mutant.
Mhm. What are the most promising areas of future research regarding lasofoxifene's mechanisms or clinical application in bone biology?
I think that moving forward, the clinical implications of this is that hopefully through more rigorous clinical trials, that lasofoxifene will be sort of a standard of care for patients with breast to bone metastasis, because hopefully it will alleviate a lot of the side effects and symptoms of bone metastasis, not only the metastatic burden, but also the increased fracture risk, bone pain, things like that. So hopefully we will see sort of a shift to using these new generation endocrine therapies more often than not, for just the increase in patient care.
Mhm. Are there any known drug interactions that might be relevant as this moves towards clinical trials?
Absolutely. So lasofoxifene is currently in a phase 3 clinical trial with abemaciclib as a combination therapy. Often endocrine therapies are prescribed in combination with PI3 kinase inhibitors, or maybe cell cycle inhibitors like abemaciclib or ribociclib. So I'm sure that moving forward we will see a number of combination therapies with lasofoxifene, just depending on the subtype of cancer that patients have. Like I said, PI3 kinase inhibitors are really frequently prescribed for patients with mutant PI3 kinase or PTEN loss. So that's, I think, kind of the next few clinical trials,
Mm.
similarly to elacestrant, which is a compound that was just approved a number of years ago, but it's currently in trials with all of these different combinations that are frequently used in with endocrine therapies in ER-positive breast cancer.